Workshop to order. The first thing on my list says proclamation of September as Suicide Prevention Month. Kaylee Hernandez, Community Health Specialist, is here to talk to us tonight. And I will turn it over to Kaylee, right?
Yes. Yep.
Yeah, I thought I had it right.
Now, I'm not sure if you all want me to read over the proclamation, if that would be helpful, or if you have already reviewed it.
Well, it came in my packet and I did read it.
Yeah.
And I'm gonna read it for the council, so, but you can give us the finer points of it.
Okay. Well, I did print out some local data too, if you want to look at those. But basically, I work with the Statewide Health Improvement Partnership, and I sit on the Medelia Community-Based Collaborative, and I work with Watonwan County Public Health, and there's been a lot of work being put towards mental health and suicide prevention and resiliency. And the proclamation would be kind of just one different angle that we're hitting it at. When you're looking at the data points, you can see these are statistics from the Minnesota Student Survey, and the first page is specifically Medelia schools. So it asks kids in the last 12 months, how many times have you purposely hurt yourself or injured yourself without wanting to die, but such as cutting, burning, or bruising yourself? About 75% it said 0 times. 1 to 2 times was about 8%. 3 to 5 times was about 8%. And then 6 plus, close to 3%, with 20 or more times also close to 3%. So you can see that Medelia, along with the nation, is struggling with some suicidal and self-injury issues. The next data point says, have you ever seriously considered attempting suicide? No being 80%, and yes being, during the last year, about 19%, and yes more than a year ago, close to 3%. So on the next page, it talks about suicide rates for adults. And you can see here that this is preliminary data for 2020, but we're expecting to see a decrease from 2019. So this is a good news, but if you look back at the data, 2020's data is still quite higher than 2015, 2016, so it still is on the rise from the past 5 years, being higher than 700. So there is quite a need for some suicide prevention measures and building resiliency within the community and just talking about it within the community. So this proclamation will really help raise awareness of the issues. This isn't the sole thing that we're doing. Myself with MCDC, we're working on putting together an event to raise suicide prevention awareness. And that will be in September, after school starts September 29th. So that event is going on, along with doing other things throughout the community, like making sure to post things in schools about resiliency and mindfulness, providing calming kits within schools to help children learn about emotions and how to deal with things that are hard, increasing knowledge of services that are available through social media and other avenues, and just supporting healthy decisions and empowering individuals and communities, families, to prevent against suicidal risk.
Have you seen an uptick since the pandemic?
So, the preliminary data says no.
Okay.
But Watonwan County, we have seen an uptick recently in attempts, suicidal attempts, not necessarily completions. And I have Julia on the phone from Watonwan County Public Health, and she can probably speak more to the data if she's able to be heard.
Okay.
Can you guys hear me okay?
Sure
Yeah.
can.
Alright, so again, this is Julie Rickman with Watonwan County Public Health. I can echo what Kaylee has already mentioned in regards to the uptick in self-harm related reports that emergency medical services have seen emotional and behavioral coping mechanisms that we're really trying to focus on with those early young kids. And I can also tackle a little bit more about, public health supports this proclamation and how important it is to the community as they continue to thrive and be resilient despite the growing challenges rural Minnesota faces, healthcare being one of them. I really want to highlight the tremendous encouragement it provides to those who haven't yet or are currently seeking mental health and emotional support. And just thank the city for their consideration of adding this to their other important work in elevating the community of Madelia. It is a big step in the work that aligns with Madelia Health, formerly Madelia Community Hospital and Clinic, as well as the work that Public Health and Human Services has done. But and I want the City Council to know it doesn't necessarily stop at awareness. So the action steps, continue on. So such as provider and teacher trainings, peer supports will be implemented within the coming year. My final talking point really kind of goes along with that. And talking about it doesn't make it happen. It makes it visible and opens our eyes to supporting our community with their needs. And this is a need that we've seen within our community, is raising awareness and having difficult conversations in regards to mental health. And I think this is a really great step that aligns with the other work that the partners that Madelia Health already has is working towards.
So to be clear though, it's not just about suicide prevention, it's about the coping mechanisms as well.
Correct, yeah.
Okay.
It's very all-encompassing. So it's not just here's a big bold statement about self-harm and deaths by suicide, but as well as kind of recognizing the resilience beyond that. So what are some things, prevention and then recovery that Madelia supports in line with, Madelia Health and Public Health and Human Services.
So are these services all free, or anybody can walk in and be seen at any time, or?
I guess I don't understand the question. Are you thinking
Is it open to, are the services open for everyone, and is it available 24/7?
There's call lines and text lines that are available 24/7 and free to the community. Do you want to speak on behalf of One County beyond the call lines and trainings you mentioned as well?
Yeah, so there's also the mobile 24-hour mobile crisis unit that's out of Mankato, and they serve One County. And so if somebody is having an emotional or mental crisis, they're able to call the line and they will send out supports. So individuals who are trained to kind of respond to someone in crisis and kind of help them kind of navigate what's going on at that moment, to hopefully avoid someone being admitted into the ER or anything like that. In regards to cost, I don't believe there's a cost for accessing that support. I believe it's free and confidential. And then in regards to the trainings that Public Health and Human Services sponsors, they are free. So the trainings that we are looking to implement within the community, as well as our providers and teachers, that's all free. We try and make sure that it's convenient for them, whether that be trying to do in person or virtual, because the teachers and doctors also have other important work to do as well. So we really want to make sure that it's fitting their schedules. But it is free and it is open to other community members too. So our hope is to make sure that there'll be more community work. And I do know, Kaylee, you might have to correct me on the dates. I think it's September 19th is the first event in Madelia that is sponsored through Madelia Health and Public Health and SHIP. And I might be missing another sponsor that focuses on resilience and mental health. And so it's kind of similar to like a little block party. So there'll be a number of events. I believe Madelia was looking at doing like a bounce house and things like that, and food, and raising awareness for the whole kind of spectrum of mental health, from prevention to supports.
And these services are also bilingual, right?
Did you say by appointment?
Bilingual.
Bilingual?
Bilingual, thank you. Most providers have access to an interpreter for services. Not all providers are bilingual, but typically they're able to access services and provide information for individuals in multiple languages.
And what's the easiest method to get a hold of somebody say at 10 o'clock at night, police department or the comm center or?
In regards to someone experiencing like a
Yeah.
mental health concern,
Yeah,
you know, it might depend on kind of what the needs that person is having. So if they're having self-harm thoughts, or if they are, you know, currently attempting self-harm, you know, it might really depend on the situation. And so I mean, I guess that's a tough question to really answer. So it kind of depends what's going on with them, but you know, it could be the crisis center. They might be able to kind of help triage. Certainly, law enforcement, you know, could be an option. However, they might need to refer them on to someone who's specialized as well, kind of a little bit more in depth with mental health. I think Rob mentioned he told me he was going to be there today. Maybe he can speak on that one for me, but. Yeah, so I you know, mention counseling, emergency room nurses also have some training, but that's kind of our hope is that we can put the tools in our community's hands. You know, we can't prevent the rain from falling, but we can put umbrellas in people's hands, and that's kind of our hope is that we can kind of with this proclamation kind of align and make visible the work that public health and other community partners are doing to kind of show the support we have for our neighbors and our community members. That, you know, it might not be, you know, going to the emergency room, but maybe having a friendly conversation with the neighbor about maybe something that's going on, you know, really can help relieve someone's stress or some other healthy mechanisms that can prevent us from going to the emergency room. I hope that was helpful.
yeah.
So we're kind of hitting this countywide. We're bringing this proclamation to St. James and Butterfield as well, and then the events are also being posted in Butterfield, St. James, and Adelia.
Completely agree. I think this is a tremendous initiative. The only thing I would say is it's bigger than suicide prevention. It's mental health resiliency. And as we go forward, we need to communicate that piece.
I would second that thought. Anybody else got any questions for statements, concerns? Well then, at 7 o'clock tonight, I will read the proclamation. And I thank you for your presentation tonight.
Thanks for coming in.
Thank you.
Thank you. Appreciate it.
Thank you for your time.
So do we have anything else on the workshop for right now, Chris?
I'm sorry, what was that, Mike?
Do I have anything else for the workshop at 6 o'clock?
Other than just going over, what we have on the agenda tonight.
Okay.
And then also wanted to give a heads up on all of the budget meetings that are going to be set up. So on September 13th in the workshop, we will discuss the budget. And then September 27th is the preliminary tax levy. But in that meantime, I have meetings set up with staff and all the commissions. So currently I have a golf commission meeting set up September 1st at 5:30. Liquor commission budget meeting, is set up. Park commission budget meeting is set up. Street commission meeting is set up. We're still working on the police. And then I also have a water and wastewater commission meeting set up. So after going through those, then we will have the whole grid for our workshop on the 13th to go through each one of them.
And when's our preliminary budget have to be approved?
On the 27th of September. On the administrative items for tonight on the agenda, we have Jeff and Tammy Allman that will be here at 7. Their liquor license was approved at the state, so tonight we will have to approve their license. Fisher will also be attending tonight to discuss, hiring, for the new positions. And then also Chief Fisher will also be here tonight discussing the increase on the fire relief pension. They would like $100 increase from $1,600 to $1,700.
When was the last time we did it?
It was before my time. Gene was here, I know that. So Ryan is upstairs right now discussing stuff with his captains.
You know, it's been quite a while, but I don't remember how long.
Do we got info on what everybody around us is doing?
5 or 6 years.
I'm gonna need that.
Do you want me to go up and get Ryan? He can actually
Well,
comment.
there should be documentation on what everyone around us is, what their retirements are doing, what
And
St.
Ryan would
James,
have that
Sherman.
documentation, not myself. Do you want me to go get Ryan?
Might as well.
I'll just text them.
Might as well. Cause you're both on fire, right? You're not, you are, you can't vote.
I think you raise a good point, though. Why?
No, maybe we're just.
That'd be a great why.
We don't, we just need all the info, that's all. I thought it was, I didn't think it was that long ago, to be honest with you.
Uh,
I thought maybe 2019. Seem to remember.
2 years ago?
Yeah.
right before Chris started, been the last
I
year
think so.
Jane was here.
I have absolutely no context I can put this into. I don't know. What do you think?
It's $1,600 per year of service what the firemen put in. They have to put in 10 to be vested. They have to put in a full 20.
Well, I'm tracking with you totally, but where does this fit with, to this point?
I'm
Where does
guessing
this-
we're low. It always has been. In the neighboring towns.
That's not good, because we've got the best fire department around.
It was 11 or 1,200 when I got off 15 years ago. So it's went up some, not a lot.
And do we know what,
Alright,
we-
I wanna raise for council meetings.
Hello.
Just got one.
I'm just saying, this is what it feels like.
Ryan,
Yes.
I brought up that you would be attending the meeting tonight in regards to the fire intervention, in regards to for requesting $100 increase from the 1,600 to the 1,700. The council has a couple questions.
For sure. Yeah.
What the areas around us, how much are they getting? St. James, Sherman?
Okay, Medelia at 1,600,
Yeah.
Lake Crystal 2,100, Mapleton 2,200. I did like the size cities. Springfield 1,550, so they're 50 below us, but I believe they've had an increase. These are 2-year-old numbers based on how the audits go. Mountain Lake is 1,200, Casota is 2,700, Good Thunder is 2,000, St. James is 2,175. The reason for it is,
Thanks for the info.
yeah, the reason for it is, and I have that for all you guys too. The reason for it is that about 14 years ago, they got way behind. And so what happened was then they did an automatic step increase. And the city auditor didn't like that, committing future councils to, but they did an automatic increase. Then we went quite a bit without an increase. And then we were kind of told to come back every 2 to 3 years, just to do small increases instead of like $200 or $300. The last increase was $200 to make up time. And so we didn't feel it was right to come back last year, which would have been our time to come back because of COVID and the uncertainty of what was going on. And so this year we did 300, or 3 years later we're doing the 100. The state auditor allows a ceiling. I have the audit here too, because it has to be audited, all the funds. It should be a self-funded relief plan. And the thing is that there was a small contribution last year, but this year the relief, everything in the stock market did well, and so we will not have a city contribution. So there will not be a city contribution for the first time in a while by the city for coming up. But the thing is that, and then they did say that we are up to $1,800 as a limit that our fund can sustain that. However, we're also realistic in knowing that the stock market, what comes up can come down. And so we thought that $1,700 was a safe spot. I mean, based on the audit, we should ask for $1,800, but we're not asking for that. We're asking just because we don't know. We'd like to keep it self-funded and not ask for city contribution. One thing that's kind of cool this year, not cool first, is that Chris Champlin is leaving, but something that we talked about for a while, and he's been our relief chair for a long time, but is having the state manage our special fund. And so the performance of that, you know, with the state is outstanding. And so we have full confidence that that's gonna be a positive move anyways. So all of our funds will be transferred to the state plan. And by doing that, we should see a bigger result.
And it'll still get audited the same way.
Well, it has to
just
be audited. But
a
it's
different
not as
holder.
stringent of an audit. You know, right now, we spend close to $1,200 a year just to have it audited. We won't have to, it's kind of a verification thing more than anything. So. But if you look regionally around us, you know, last time I did just our populations, and there was a concern, I think, with you, Dave, that, you know, it's hard to tell because some areas might have a bigger tax base, like if they're in a lake region or that type of thing. So I did area ones this time, and, you know, there are 2 departments that are lower than us, Mountain Lake, and Springfield, but I think they're actually higher than us now, but by $50. But then the other ones, you know, but they also do have gambling, we do not, so that does reflect some of that as well. I think it's a fair ask. We always have a yearly meeting. You know, it's not really, again, anything that's funded by the city, it doesn't come out of the budget, so when somebody retires, it's not like the city is forking out that dollars. It comes from our special funds, so. But we have to ask for city approval.
Thanks for the info on that.
Yep.
Anybody else got questions for Ryan? How many applications did you receive?
4.
And how many are you gonna put on?
Well, you guys approved 2, and that's another question I'm gonna ask for. Sorry, Dave. I'm gonna ask for. The challenge is, we have 4, and they'd all 4 be good, but I think that that's a stretch, and I'm not asking the council to approve that. The challenge we have is we have 3 really good candidates, one of which is already trained, and one of which is a female, which is a great addition to our department. The challenge is, she did say that she's not sure how long she'll be around. And so, you know, looking to the future, you know, the nice thing about the fire department is that we have long tenure. The hope is that they would be there 20 years to enjoy that pension. And I'm you know, somebody with 1 or 2 or 3 years doesn't really help us build the department how we want to. However, she's fully trained. And so the cost to the city would be minimal. You know, we're lucky here in Medelia for that. You know, we've seen the other side when it comes to the ambulance, what can happen if you fall behind on recruiting. You know, I believe we have turnout gear for her that would fit. So the cost is the average firefighter, based on the hourly wage, makes about $680 a year. That would be our cost. I'm gonna ask later for the council to maybe bring her on. We still have our 2 new firefighters that, you know, our residents here in Medelia, work in Medelia, have daytime availability here in Medelia. But then maybe bring her on. I'll have to tell somebody else, you know, we're gonna pass, and that's been kind of
No
a
for
unanimous
now,
decision.
no for now.
No for now.
When the next opening comes up, they could perhaps be considered at that point.
Yep, the way we're positioned right now, though, I think, you know, I believe, asterisk, that'll be a ways away. The nice thing is we have a relatively young department, which also makes this pension thing a little different, because a lot of guys, if you look at a lot of the rural fire departments in our area, if you look at them, most of them are pushing 60 years old, if not older. That is not the case on our department. So, you know, we have plenty of time to build up that fund. The thing is that, but yeah, we will tell them, obviously, you know, keys keep your interest. It took me twice to get on. Josh Shaner took twice. You know, several people, it took a couple application rounds.
So, the person that's already trained,
Yep.
that also makes her current then with her training, because she found a department even if she only stays in Medelia for a year or 2.
She has fully completed her state things. I want to look at her certification to see if her certification's up to date. If not, it really is just a matter of paying the state $60.
Right.
We would get her certifications on. She comes from Well, she
Truman or
comes from
Louisville?
Louisville. So the thing is that they only meet once a month. So I don't know where her training level is.
Right.
But at the same token, though, she's smart. I mean, she's good. Well, a couple things. I mean, has she not raised the concern of not knowing how long, and she was honest about that, how long she'll be around, she definitely would have been a top contender. But when you're going through school, it's easier to have another person with you too. Jim can probably attest to that, fire school, because you can work off each other during that. And so,
Well, first, she was honest about it. Second, that's not a disaster.
what's that?
It's not a disaster that she's not here.
No, and that's not.
Let's say that she wants to do things and move on. That's not a disaster.
No. The only tricky part is that you're back then to square one looking again. You know what I mean? If it's one of the two that are approved,
Yeah.
that's a challenge.
Ryan, I'm sorry, how long was she on Louisville?
Only about a year and a half, 2 years.
So it's not much, but doesn't that relief money come with her for the year?
No.
I thought it did.
No, that's with para, or that, we're not with para or anything like that.
No. Used to be, it went with you. If you joined another department within so many years, hers came with her. So she went on here with 2 or 3 years of service. That's the way it used to work.
Yeah, that's not how our bylaw,
I think that's a
not-
state rule. I don't think you have a choice. It used to be, but like I said, I've been out of there 15 years too. So was
Yeah,
on the
I
road
don't
for a long
believe
time.
that. I mean, I'll verify that, but I don't believe
Check
that's the
into it.
case. Yeah.
So you're saying like if she got to that 20-year, whatever that is,
Those 2 years.
2
would
years
count.
of portion would be paid by,
No, I think it came with her into this relief,
Okay.
is how it used to work.
but if somebody
During
quit,
the
if
Magic
somebody
Jig
quit the
Coffee.
fire
Yeah,
department,
he'd be pissed, yeah.
but if somebody quit the fire department after 5 years, why would they send that money before they make 10 years?
I thought you had to because they get money from the state.
Yeah, we
Everybody
get
gets state money.
State matching money.
Yeah.
Our state fire dollars. I'll verify that, but we've never done that either for people coming or going. You know, like for example, we had Tim Solner added on from Louisville 2 or 3 years ago.
And the
Maybe
one
it had
from
to be if they had-
Ormsby we added, and
Yeah,
And maybe it had to be if they had 10 years and were vested, and you can't remember.
they
That's a
might change the
possibility.
laws, or the rules too.
Yeah.
yeah, I don't believe that's active, just, cause I took a, quick class, one of that fire school a few years ago, and that, they talk about how each relief association stands alone, so.
But it had something to do with state funding.
Yeah, I'll verify that. I
Sorry
just,
about it. Sorry to-
yeah, no, you're good. So that's where we're at. So I'm gonna ask you, we have 2 solid candidates, no matter, for sure. And I think we have 3 rock star candidates if you allow.
So what you're basically asking for is we've got 2 you wanna hire for sure, and then a third possibly you want us to consider.
That's fully trained. Yep,
I think that we just need to be clear about that fact.
yep, yep. There's an added cost to it. The nice thing is none of the costs of taking and sending them to school or any of that, that's all done.
Already been, yeah.
Yep.
Yeah, check it.
That's all taken care of by the state.
Yeah, and I look around and I look at St. James having a hard time finding people. I see my friend Jeff Becker over in Lake Crystal having a hard time finding people. Odin and Ormsby are lucky if they have 7 or 8 people in each department. Obviously small towns, but they should have 20. We've seen what it is with our ambulance. We have a great group, so whether it's 2 or 3 will be fine.
And specifically, what is the cost of adding the third person?
Be about $680, it'll be the wages is what it'll cost.
Okay.
We believe we have the equipment.
So $680 a year?
$680, yeah, approximately a year.
Until they become an officer or.
But that would just replace somebody else.
That would
That's
replace
just,
somebody.
yeah, they would fill some other position. Yeah.
So,
Just to clarify, Ryan.
Yep.
The female trained candidate, you're not gonna consider unless we add a third.
that's what we just talked about. We thought about that over the weekend. But we think, a couple issues there beyond is that she, works outside of the community. So availability wasn't as good as, and that's really the number one thing. Her availability wasn't as good. And then her tenure were the 2 factors,
So she's basically not gonna be considered unless we add a third.
Unless we have that there, only because we're looking at building the department.
No,
Yeah.
I totally agree.
Yeah. But qualify, absolutely. Jell, absolutely, I mean, all things equal, qualified, but, there's a couple things that just slightly detract from it, so.
Sure. Well, I don't disagree.
Well, thanks, Ryan.
Yeah.
Jeff and Tammy's liquor license, did we set a fee for what their, or is that a state fee?
They applied for the full liquor license, that's the only thing that we could, that's the only thing that they can be offered. So there's the same fee as what's in the fee structure of $1,200, and then a $40 Sunday. So it's the same as everybody else.
It's the same as everybody else.
The only thing is of right now, it'll be prorated for the year,
Check.
if that's what you're asking me.
No, I just wondered what the fee, and it's the same as everybody.
It's the same, but it'll be prorated this year.
It's not like the Fensky Brewery that has a special license
No,
that we had to come up with a special fee.
That's correct.
Because they went with the regular license.
The only way, like if they would have done a wine license like we gave to the bowling alley, but they would have to actually have a restaurant and produce X amount of dollar in sales of food and actually have an inspection.
Right. And this started about 4 months ago?
3 months ago for sure.
3 months. Okay. Cool. Anybody else got anything for the workshop? Then I can't have the EDA meeting until 6:45, correct?
That's correct.
So then I need a motion to adjourn the workshop.
So moved.
Second,
Second.
all in favor?
Aye.
Opposed, same sign, motion carried. EDA meeting at 6:45.